So these are an interesting class of compounds which are distinctly different from regular medicines. For the average person, the paracetamols and the ibuprofens, which we normally consume every day, these are very different from them because they involve complex chemistries. Their processes to manufacture them are extremely rigorous and time consuming. And there's a wide variety of disease states they are addressing. And right from 2010, there are multiple peptides which have been approved, which help with a very effective treatment of many disease states, whether it's deficiencies or diabetes, for example. Weight loss today is a very big category. GLP-1 analogs are a huge category of benefit from peptides. Oligonucleotides, on the other hand, are very niche precision medication. They attack very specific disease states, spinal atrophies, muscular dystrophies. We might come and hear of people who are suffering from disease states which are very rare, and that's 1 in a million. And there might be cases where there are only a couple of 100,000 people globally suffering from those disease states, and oligos play a big role in trying to solve that unmet need in terms of disease treatment. Well, the prevalence of these diseases, I believe, globally are similar. And there are regions like, for example, the Middle East, where the prevalence might be higher because there's a lot of interbreeding within populations and families. So the gene pool gets constricted. The other aspect is the ability to diagnose these diseases is pretty high in the Western world because the medical treatment or healthcare systems are far more evolved in terms of access. So we might be sitting on a larger pool of patients in the lesser developed countries, but the ability to diagnose them, the last mile connectivity to villages and towns, and the knowledge the medical fraternity may have about some of these disease states is low. But I think largely it is it is a trend of disease prevalence which could be similar all across the world. Having the largest population could mean that we might have significantly higher number of patients suffering for these kind of diseases. Weight loss, again, is more of a developed country disease. Diabetes, however, is more of a underdeveloped country prevalence. So there's different angles to it the way you look at it. Well, being complex chemistry products, there is a combination of two issues. One is traditionally the brand companies have been producing them by fermentation processes, and fermentation processes are very efficient from a cost, yield, and productivity perspective. But the agencies, from a regulation perspective, do not really come to an agreement on synthetic processes which peptides and oligos can be produced from, which largely forces the industry to make accessible medicines from synthetic processes. These processes are heavy intensity on usage of solvents, reagents, and the yields are pretty poor. So to kind of exemplify, a fermentation process may give you an 80% yield, but a synthetic process may give you only 20% yield, which means that the cost of producing that amount of medication is quite high, and it's also takes its toll on the environment. So we have to balance out a lot of things from a technology perspective to check the boxes from an environment, sustainability, and access perspective. Well, from a treatment perspective, obviously diabetes is a big area in terms of hypoglycemic control. The side effect of that, which has been discovered while trials have been done for the GLP-1s, is weight loss. And that becomes a significant, I would say, evolution to move to the next part, which is cardiovascular management. As you control your weight, you control your glycemic control, the blood pressure and the cardiovascular issues associated with high blood pressure also get controlled. I think recently some of these GLP-1s have also got label indications approved for cardiovascular management. So it's constantly moving to the benefits some of these products can give on a larger scale. It's just not linked to diabetes. It's evolved to now even cardiovascular issue management. Well, there are certainly drugs which have shown very beneficial effects in terms of either weight loss or diabetes or glycemic control. The Indian population largely, I think the diabetes is one of the bigger issues which we deal with. And while there is a combination of lifestyle, oral therapy, but these drugs do certainly offer another yard of support to those people who have really crossed a certain level of glycemic control or diabetes, which the oral therapy or lifestyle changes cannot manage. So they certainly offer a big runway for patients at that spectrum. Well, from an access perspective, obviously these would be have to be launched from a brand perspective in the market, and I think as we get closer to patent expiry, many companies would try and get into developing these products and bringing them more accessible to the population.